Hey, what's up, team? Geez, that was pretty cool. Just figured out that new feature there of the countdown. I was wondering all about how I was going to do a countdown, and here they have in this thing here of StreamYard. You actually have a built-in countdown, so that's awesome. I hope everyone's had a great Sunday. Look, we've got Dr. Richard Hulme back again. It was such a massive, overwhelming response last week to our live, and we had so many questions that we're going to have to do this on a regular basis. So just before we start, can everyone please hit the share and hit the tag your views. And now, while we're waiting, I'll bring the Dr. Richard in. I just wanted to talk about tomorrow. We've got a vaccination drive-through where we're teaming up with the Medsafe Manukau. It's happening across the road in their car park. We've got the Shot Kazi bus there. It's going to be awesome. We're putting up $5,000 each day prize money, better odds than Lotto. So it's 10K of our own money we're putting into this. So you come down and, especially if you haven't had your first shot yet, I really encourage you to come down tomorrow and Tuesday from 9 a.m. And then also, if you're due for your second, I'm due for my second, so I'll be having mine tomorrow too. So it's gonna be awesome. It's good to see we've got some viewers on. I'll bring our doctor in. Hey, what's up, T? What's up, Haley? All right. What's up, Doc?
Yeah, it brings back memories, isn't it? I think if probably showing our age there, bro, about what is it, Bugs Bunny, isn't it?
Yeah. What's
Road
up,
Runner.
Yeah. How's it going, bro?
Good. Yeah, no. It's been an interesting week. The young girl that I sent in last week with possible a reaction to the vaccine ended up just having a chest infection, which was on the X-ray, and so the good news was that what I thought might have been a side effect to the vaccine actually wasn't in the end. So that's good news.
Can you give us a recap? Can you give us a recap on that, bro? What happened last week?
Yeah. So she was a 15-year-old Tongan girl that the rest of the family members, there's 7 other family members, had all been vaccinated against COVID, and this was her second dose. And then 2 days after, or within 1 day of her having that second dose, she started to get symptoms where she felt tired and just sort of not her usual self. She didn't have any chest pains. She didn't have her heart racing or anything like that, but we were just suspicious there. Could this be something related to her heart? Because we know that it's more common in young men, but this was a young woman. And so we sent her into the hospital and the tests all came back, and the good news was that her heart was just fine. And in fact, it was her chest. And when the hospital recognized that, then they said, okay, well, let's pop her on some antibiotics. And she got better. And I phoned her today and she said she's doing really well and parents are really happy. And so that was a good outcome. And then I had another call from a young 27-year-old man who had COVID back in August. And this is another interesting story because he wanted a medical certificate because he's nearly 2 months now since he had COVID. And he went back to work initially, but then found that he lacked in energy and had to go off work again because the COVID was starting to make him feel tired and exhausted. And that's one of the interesting things about COVID is that it's, there's been a lot of publicity around getting the vaccine, but actually there's not a lot of publicity about those who are living with COVID after they've had it. And so here's this young 27-year-old man, previously fit as, didn't end up in hospital with COVID. Fortunately, he didn't end up in intensive care, but he said to me that he was just really, really breathless. And he was just walking around the house. He couldn't get over how breathless he was. And then finally he went back to work and he only managed a day and he had to take the last 4 days off work because he was just really exhausted. And this is a recognized complication of COVID, the disease, where they get these problems. And so I just thought I'd put that in there because that's another side of the story that we really haven't really been touching on so far. But it's an interesting story. Young, fit, 27-year-old Samoan, previously well, got the disease, didn't end up in intensive care. And the data suggests that 80% of people are going to have what they call mild disease. But mild just means you don't end up on oxygen, you don't end up in hospital, but you can still be significantly affected. So I just sort of present that case as well.
Yeah, and that's an important thing. Like, I want everyone to understand that's watching. We're not here. We're not paid by any health department. We're not asked by the government to do these. This is just two guys getting together to just give information. For me, it's about getting information out there coming from someone that's not only a doctor, but that's someone that's working on the front line. So thank you so much, bro. We're going to fire into these. Oh, and just before that, thank you for talking about the young girl. I'm so happy to hear that she's doing better. But, when we did that, people were mentioning me, see, Dave, see, I told you. And so here she is. It wasn't actually the vaccination.
Yeah.
And the more I'm getting educated on this, the happier I am that I am, giving advice around it, or using my platform to get people on to give advice. I'm more happy that I've actually got vaccinated. My second shot will be tomorrow at our drive-through, because I'm actually learning about this. And that's what it's about, just being comfortable and putting out information. So our first question, we only got 10 questions, and then we'll take some from the crowd. So these are just some general questions here from last week. So will the Pfizer vaccine be a yearly thing like the flu vaccination?
And the answer is yes. Yeah, the answer is yes. And as we mentioned last week, we're not really sure how long the protection lasts for with getting 2 doses of the vaccine. Some people say it's 6 months. Some people say it's 8 months. We're not really sure at this stage, but we're watching what people are doing overseas. There are some people who are vaccinating after 6 months. And I happened to catch a program that was on the telly that was in America. And they were vaccinating with a booster or 3rd dose after 6 months, and people over the age of 65, health professionals, and those who are at risk, because of their occupation. So that was one country, that's the US. Some people are doing it after 8 months, but at this stage, there doesn't seem to be any consensus on when it should happen. Our government's focus is on making sure that we get everybody at least 1 dose, which only gives us 55% protection, but 2 doses will get us 95% protection. And that's what we're aiming for, is to try and get as many people to have at least 2 doses. And I think that's one of the other questions that's coming up later on is, why did they change it from 6 weeks down to 3 weeks? Is because there's this intent to get as many people fully vaccinated as soon as possible.
And I'll go back to what I said last week. If we're wondering if people are going, oh man, you mean I have to go back for a booster? I have to go back once a year, just like the flu shot. Geez, if only we went to KFC and all these other fast food joints, if only we had to go there once a year, it would be a lot healthier society. So it's all about mindset for me. If we're willing to go line up in a drive-through, which I'm not judging anyone for, I'll probably go there on the way home. But if we're willing to do that once a week, twice a week, whatever the case may be, hopefully not that often, then surely just going for a booster shot once a year is no big ask, So
the other thing we need to be mindful of is that the viruses are forever changing, and so our answer to that has to be changing as well. So we know that we have to change our flu vaccine every year because of the changing strains that are happening in the Northern Hemisphere. And I suspect with newer strains of COVID that we're going to need to modify our existing vaccine, which is why, our government's always waiting to see, hey, is there something better available that we should be giving our population, our people, So the aim is, the best available information, the best available treatment, and making it available to everybody.
Yeah, and that's just on the vaccine. I saw some stats the other day about, the vaccine doesn't stop you from getting COVID. It lessens it, so you're less likely to get it. But if you do get it, you're a lot less likely to end up in the hospital, right? It's like, what was the percentage there? It's like 90-something% less likely to go into hospital.
Yeah, no, they say that 1 dose will save your life and 2 days will keep you out of intensive care, is what they say. In terms of actual numbers, hard to say. I haven't seen any figures on that. But definitely, if you've had the vaccine, I think, well, I don't want to jump ahead of the questions, but if you had the
Yeah.
vaccine, then it certainly means, one, you're less likely to be able to transmit it onto somebody else, and two, you're more likely to not get as sick, right? So it has its advantages.
I'll take a question just from the crowd here. We got one from Corsair. Any story about the Novovax vaccine, that more or less side effects?
Yeah, look, I haven't seen a lot about that vaccine yet because it's still in the studies stage. We know that it's about 91 to 93% effective. Not quite as effective as the Pfizer vaccine at 95%, but it's still at an earlier stage from the studies point of view. I know that some people are hanging out for the Novavax vaccine. It is different from the mRNA and from the typical or the natural kind of vaccines that we talked about before, which are the virus vector type vaccine. You know, we've got a weakened virus, and that helps to trigger the body's immune response. This is a different one again. It's a different kind of vaccine, different technology. Again, around trying to simulate what the COVID virus looks like and then triggering an immune response. So
Yeah.
we're still watching that space at this stage, and similarly, haven't heard much about side effect profile compared to the other vaccines.
I had a good question here from Haley. She's one of our members of BBM. She goes, "Hi, why aren't we hearing about the deaths, adverse effects from the vaccine that are published in the Medsafe page every week? I'm scared of what isn't being told openly."
I think, thanks for that question, Haley. I think we talked about that a little bit last week, where we know that there was a case of a 55-year-old, I think she was 55 or 53-year-old woman that died related to heart complications from the Pfizer vaccine. Now, they couldn't really explain why that occurred. And certainly she's not in when we look at the literature internationally, it's predominantly in young men. So she was quite out there in terms of, one, being a woman rather than a man, and similarly being older rather than younger. So we're still finding a lot out about this. In terms of hospitalizations related to the vaccine, again, we know that the majority of people who have the vaccine have very few or minimal side effects. And I expect that's the reason why we're not seeing figures being published. I think, you know, we try to be open and honest about this because we've got nothing to hide in terms of why wouldn't we say this, you know, if there was something bad about it, because all of us don't want any harm to come to anybody. You know, we want the best for everybody. We want to keep our most vulnerable protected, right? And why would we all subject ourselves to the vaccine if we thought there was some potential harms like that? I think we do know that if you get the virus, the harms that are caused through getting the virus are far worse than what they are from getting a vaccine. And hence that's why we've pushed on and still persisted, because the benefits outweigh the risks.
Yeah. Awesome, bro. The next one here, if you already had COVID, can you catch it again? That's a good question.
Yeah, and the answer is yes. Just like you can get a flu again, right? Just because you've had the flu once before doesn't mean you're not going to get the flu again another time, right? And we all know that you can be immunized against or vaccinated against the flu, still get the flu, right? And maybe you might get it another time, but generally the symptoms are much milder and much shorter than had you not been vaccinated at all. And I suspect that's going to be the same with the COVID, and that people who have had it will have some protection. But even so, there's still it's still recommended they get vaccinated. And when I spoke to that young man who I mentioned before had COVID in August, he's had his first dose of the COVID vaccine and he's due to get his second dose shortly. Probably you might see him tomorrow.
Oh, that's good. Awesome, bro. I'll take another question there. They're coming in thick and fast from the crowd. We got Daisy Jane. Do you know when the alternate vaccine will be here for those that can't have this one, please?
I don't, is a short answer. We know that government was expecting the other types of vaccines like AstraZeneca and so forth to come in. I suspect with all the bad publicity that we saw about the AstraZeneca vaccine in Australia, that it's less popular now, and that may be the reason why, because it's less effective than the Pfizer vaccine. So for most of us, we're of the opinion that the Pfizer vaccine is not only the most effective, but it's the safest.
Yeah, so we got the best one that's out there at the moment, eh?
That's correct. Yeah.
Then we've got one from Jobus, another member. What are the other options other than vaccines?
Well, at this stage, there's just the usual public health measures, right? So wearing a mask, trying to keep distancing, washing your hands. If you're sick, getting tested, staying home if you're sick, and isolating and that sort of thing. But apart from those public health measures, vaccination is really the only way to prevent yourself from getting the disease. And the reason why I say that is that what we don't know is that some people can have no symptoms and still carry the virus. That's the scary part. Someone that looks like Dave or myself could be in the community, not aware of having COVID, but they've got it and they can pass it on. And that's the scary part, is that we can't tell by looking at someone if they got COVID or not. So for us, the best protection is getting vaccinated, and that's why the big push.
We've got another question here from Corsair. This is one I hear a lot, actually. Isn't it better to go in natural ingredients? What's wrong with lemon, ginger, honey, and warm water?
I think those remedies are really good when you're sick, but unfortunately, it won't help prevent it. I mean, there are a lot of people who are huge fans of vitamin C, right, and high-dose vitamin C, but we don't have the data to suggest that it will protect you against these diseases, right? We know that people will use those in an attempt to get better once they've got something, but unfortunately, the data's not there to say that, hey, look, if you do this, you'll get 95% protection.
Yeah,
That's not there.
I think there's nothing wrong with it. You've got to do everything.
Yeah.
You've got to tick every box. For me, you've got to tick every box. It's just like if you're training to get fit and trying to lose weight, you can't just train.
Yeah.
You've also got to eat right. You've also got to drink water. You've also got to sleep. You also can't hang around people that eat KFC all the time. There's all these things that you've got to tick the box, to achieve it.
That's right.
Again, the same thing. We've
That's
got
right.
one more from Shiana. Are there any known side effects for people who suffer from asthma?
Well, I'm an asthmatic, and I'm glad to report that there are no side effects for people who get asthma. And I think that's one of the reasons why I had it, because I know that's a weakness in my body. And, for anybody that's got a chest problem, the last thing you want is a chest infection or something making you short of breath, more short of breath than you've ever been, because we know that it makes people who don't have asthma super short of breath. So if you're an asthmatic and if you're overweight, then you just don't want this disease, because it will make you super short of breath.
Bro, just tell us, so if you get a bad case of COVID and you've seen it, explain to the people who are out there who are saying it's like, come on, it's just another cold or it's just another flu. Tell us what it's like. What have you seen?
Yeah. So look, the people that I've seen who I've had to send to hospital, they're short of breath. They have surprisingly low oxygen levels. And the thing is that, particularly last year when we were seeing people with COVID, they would just have to walk for 30 seconds and their oxygen levels would drop significantly. 30 seconds of walking, right? So this condition makes people very short of breath. And they can have all sorts of problems. Really, everyone's different in terms of what they come down with. But I want to emphasize that the majority of people that get COVID are going to have a severe flu-like illness, but they won't necessarily need to go to hospital. And I think that's one of the things that the government's considering now as we start to run short of spaces in managed isolation facilities, particularly if numbers continue rising, then we're going to have to manage people at home, right?
Yeah.
And only as best we can, and then only send those who are super short of breath and super low on oxygen to hospitals. And so part of that surveillance at home will be providing people with special meters where they can check their oxygen levels, and they get sent out to people, and nurses then check in on patients who have got these special meters at home and check on how they're doing. If they're super low, then an ambulance will get called to come and assess them, and if they are super unwell, they then get taken to hospital. So we're watching this space at the moment as, as numbers start to creep up. I mean, fortunately, they crept down today, but if they start to creep up, then it won't be long before managed isolation facilities get full, right? And then keep watching them in their own homes, in the community, and then deciding if they're sick enough, if they're short on oxygen in particular, then they need to go to hospital. So that's probably the main thing that we're looking at. And we look at all the treatments that are available for COVID, particularly in hospital. A lot of it is based around the need for oxygen and ventilatory support, where they need to go on a ventilator. So the breathing is the biggest problem. And that's why you sort of see this emphasis on people lying on their stomachs in the bed, right, to try and help them to breathe easier. Or if they can't lie on their stomach, lying on their side, but with several pillows propping up their head to try and make things easier for them to breathe.
Awesome, bro. So we're taking a lot of questions here from the crowd. Daisy's asked, how do teachers get an exemption for medical reasons, please? Is that an exemption from the vaccine or exemption? What is that?
That's an exemption from the vaccine because of the push now to have all teachers mandatory vaccinated against COVID, right? And so look, what we know is that the only reason why from a medical perspective, why you can't have the COVID vaccine is if you have an allergic reaction to any component of the vaccine, or if you've had a previous allergic reaction to the COVID vaccine, and that would have to be a significant allergic reaction. Other than that, there are no other medical contraindications to getting vaccinated at this stage.
I mean, that's where it's at, man. I've been working with different companies to get people into employment. And one of the first things I say, what do they need? Tell me. One of the first things have to be vax, at least first jab. And then once they start, they have a certain amount of time to get their second one. Yeah, I mean, it's crazy. We were just talking about it off air. It's hard seeing this divide that's being caused. I mean, I believe in this vaccination and getting people vaccinated, but I don't begrudge anyone that doesn't, But the thing with anti-vaxxers, I don't go on their page and start telling, get the vaccine, get the damn vaccine, like a lot of these messages that I get. So we'll move on. We've got Andre Hedewini. If you're a vaxxed person and you catch COVID from an unvaxxed person, is it worse than if you catch it from a vaxxed person?
That's an interesting question. Essentially, if you are vaccinated and you get COVID, you're more likely to get it from the unvaccinated than you are the vaccinated, right? So the person that's unvaccinated is more likely to transmit the virus more easily than the person who is vaccinated, right? So hence, that's why there's so much pressure on those who are unvaccinated to get vaccinated, because they're going to be potentially magnets for the virus, right? The virus is going to seek out who hasn't been vaccinated, and there's a greater chance they're going to get it, right? And therefore, because they can get it, there's a greater chance they're going to be able to transmit it. And I think everybody has the vaccine to protect themselves, but we know that no vaccine is 100% effective, just like no mask is 100% effective. I think you can get some masks that are 100% effective, but in New Zealand, we get the N95 masks, right, which filter out 95% of all the particles in the air, right? There are N99 masks, and I believe there are N100 masks, but no measure that we take is 100% effective. And I think the reason I'm trying to emphasize that is that it's good to protect our mouth and our nose with a mask, but if we're not protecting our eyes as well, we've left ourselves open, right? So, sorry, it's a bit of a around the.
Yeah.
I tend to talk in tangents sometimes, but the key thing I'm trying to say is that, yes, we're doing the best to protect ourselves with a vaccine, but it doesn't necessarily mean it's 100% effective. So we don't want to get the virus naturally. That's why we hit the vaccine. And so anything that increases our chance of getting the virus, obviously we're going to not be too happy about that, which is why you're seeing all the angst about those that are unvaccinated, right?
Yeah.
And why you're also seeing the pressure to get children vaccinated, right? 5 to 11, and then from 6 months to 4 years vaccinated ultimately, because the children can also carry the vaccine, right? And we all love our kids, but unfortunately they can be victors of the vaccine because they're unvaccinated at this stage.
And that's what we're talking about. You hear it, do your bit, not only for yourself, but for others. I think about what you just said earlier about, if you have a bad case of COVID, leaving you breathless, walking 30 seconds can leave you so out of breath. Now, if you think about some of the people that we help here in BBM with our From the Couch class, which some people without COVID will struggle to walk, and that's why we're here. We're trying to get them healthier and watch what they eat and get their mindset right, so that they're able to not only walk and stand up for the whole workout, but then also to one day be able to get down on the ground and then back up. For some people that we take it for granted. For some people, if they fall over, you got to call the ambulance. So imagine if that's why we're so big. I'm so big on this, because if they get COVID, geez, they're in trouble. These people with underlying health issues. That's I think that's how our people need to understand.
Yeah.
Anyway, I digress. So we've got we've got a question here. What impact will it have on your immune system?
It'll make the immune system stronger. It doesn't make it weaker, right? So if you look at all the vaccines that we've had since we were born, right? We've had vaccines against diphtheria, tetanus, polio, pertussis, which is whooping cough, the flu vaccines, hepatitis B, Haemophilus influenzae now, type B, now we're getting rotavirus vaccines. So, I mean, the amount of diarrhea that we used to see in kids before has just dropped off because they've been vaccinated against this rotavirus that caused really nasty diarrhea and made kids so dehydrated we have to send them into hospital. So our immune systems are better off as a result of all these vaccines. We don't see polio anymore. We don't see something called epiglottitis, which used to be a condition that made kids have really high fevers. And this little area called the epiglottis, which is above the windpipe there, used to swell up and make kids dribble all the time, all right, when they're really high and really feverish. We don't see that anymore. It's been wiped out by these vaccines. So, it's at this stage with COVID, it's not the golden bullet like those other vaccines are, but it's certainly the best defense that we've got at the moment.
Well, I've got a question here from one of our team members here, works for BBM. She's on the fence. So was my wife, actually. She was on the fence, and then our talk last week, the next day she went and got her first shot. So thanks, Doc.
Awesome.
So that was good. Ina's asks, so she goes, so the vaccines will prevent you from getting COVID, but you can still catch COVID if you're vaccinated. I don't get it. Yeah,
that's right. So as we said before, nothing is 100% effective, right? It's the best defense that we've got. Yes, you can get it, but the good news is it will be a milder form, right?
Yep.
So it won't, as I mentioned before, you need to have 2 doses to have the best protection, right? And the reason for that is the first dose gives you an immune response, or your body's defenses are up there. They're about a 55% effective. But it's not until you've had that second dose and then 2 weeks after that second dose that you're 95% protected, right? So, I hope that answers the question.
Yeah, and the thing that I want to stress also, it's good that because I'm not a doctor, so Ina doesn't listen to me, but that the thing is, you're a lot less likely to go to hospital if you do get it. And that's the big thing for me, right?
Yeah.
And so I know you'll be first in line at our drive-through tomorrow. All right, we got the gap between doses 1 and 2 of the Pfizer vaccine has been reduced to 3 weeks. Why the variation? I think you answered that earlier.
Yeah, so it's because there's a greater need to have people fully vaccinated, right, which is 2 doses. The initial reason for it was started off at 3 weeks, actually. But then there was some research that suggested that maybe if we allowed a little bit longer between the doses, that the immune response might be better. But then they found that, and then the other approach was to make sure that we had as many people at least having 1 dose. We were aiming to try and get everybody fully vaccinated, but that meant that a whole lot of people hadn't even had their first dose. So then they decided to stretch it out to 6 weeks. But now they're realizing that, hey, we need to get as many people fully vaccinated if we're going to try and eliminate this disease. But yeah, so that's why it's been shortened again, because they want to try and get as many people fully vaccinated.
Yeah. We've got a question from Mina, one of our team as well. When do you think, how long do you think we're going to wear masks?
I think forever.
Yeah.
Yeah. Good question. But this virus isn't going away. Delta's here to stay, right? And its cousin's probably around the corner, right? And because we don't know who's got the virus, we talked about protections, right? Public health protections, like wearing a mask when we're in public spaces, trying to keep our distancing where possible, washing our hands, doing all those things. I think masks are here to stay.
Yeah, I do too. What do you think about, I always go back, I think it was a couple of years, the measles outbreak in Samoa.
Yeah.
I had a lot, Tuala Tusani did a lot of work, and I remember I helped them just a little bit, and I remember going to Main Freight where they had, they were about to send containers of coffins because they ran out of coffins over there.
Yeah.
And it really stuck with me, and it was oh man, just the feeling inside when I seen these baby coffins.
I know.
It broke me, and I was going, man,
Yeah.
that was, I always think about that, and it's surely, when people are talking about us, and surely isn't that you look at what happened there.
Yeah.
What's your thoughts on that? I always say, if you were a parent, if they had the option, if they had access, looking back in hindsight, it's always a wonderful thing in hindsight, but
yeah, I mean,
an avoidable thing,
Yeah, totally. I mean, the problem in Samoa, of course, as we all know, was that there were a couple of children that died after the vaccine was mixed with the wrong diluent. So it's like a water, right? And the nurse, instead of mixing it with the water, mixed it with a drug that ended up killing the baby. And the same nurse did it to a second baby. And those deaths then put the fear of God in everybody in Samoa about getting their children vaccinated, right? And so then it was a tinderbox just ready to catch fire, right? And it caught fire, right? And then we saw so many children die from measles in Samoa. That was a tragedy.
Yeah, I didn't know that was the story behind it. So it was someone that had mixed the wrong drug.
Yeah.
Had mixed the drug instead of the saline.
Instead of the water, instead of the saline. Yeah.
Oh man.
Yeah. And because this happened in the villages, right? It was in the districts. It wasn't in the hospital. And we all know that, that in remote places, whether it be rural and remote New Zealand or rural and remote Samoa, that sometimes medical supervision isn't there, right? And people are potentially at risk. And unfortunately, it was the one nurse. And I think we have to remember that it's one health professional that, had the problem with error. And unfortunately, it painted, all district hospitals with the same brush. Is it
Mm.
unsafe at all our district hospitals in Samoa? Do you know what I mean? So we have to be careful about generalizing. But yeah, lessons were learned, and I think the
Yeah.
systems had to be reviewed as well. And I think that's what happened
Mm.
through the case.
Yeah. I mean, I always just, yeah, it was such a sad thing.
Yeah.
And I just stuck with me to this day when I went and seen all these baby coffins. Oh man. Got another question, bro, from Linda Kendall. What are your thoughts on the vaccine for 5 to 12-year-olds when it is made available? Is there any chance of reactions to the vaccine based on age?
You know, my understanding is that for the younger age groups, they're going to have a smaller dose of the vaccine. So there is going to be an age weight reduction like we do with other vaccines. So they don't get that adult dose, they get a child dose of the vaccine. So that's another step in making it safer. So
Okay.
yes, it's being rolled out, as I mentioned, in the US at the moment. The 5 to 11-year-olds are being vaccinated. I know that studies are happening in the UK at the moment with 6 months to 4 years, right? And obviously, our government's watching what happens to children overseas to see that they're satisfied with the research that's coming out there to see that it is safe for our children.
Yeah. And I think the word research, I think it's important for everyone here watching to ensure that you're getting your research from interviews like this and other, professional sites. Don't go down the wormhole of YouTube and stuff like that. We got another question from B. Dr. Hulme, we know what will happen if you're unvaccinated and contract COVID, but is the vaccine safe to have for those overweight with heart problems? And if you have heart problems, are you more at risk of getting pancreatitis? Sorry if I don't.
Getting what?
Of getting, yeah, that's it.
Okay, cool. That's all good. It's a different language, eh? I remember that when I decided I wanted to be a doctor, I was about initially 12. I read this book on the heart, and by the time I was 15, I thought, well, this is a lifelong career. So I went to the medical school. So before I even got into it, went to the library. Thought, okay, well, there's all these shelves. I'll just sort of start in this corner. I'll work my way around, right? So I grabbed the book off the shelf. I opened it up, and there was another language. And I thought, you silly idiot. Closed the book, put it back in the shelf, and left the library straight away. It's a completely different language, right? But to answer the question, the vaccine is safe if you're overweight. It is safe if you've got heart problems. It's safe if you've got asthma. The whole thing to remember here is that getting COVID and you've got those problems will give you worse side effects than the vaccine will. I'm overweight, I'm asthmatic, I've got heart problems. I had no problems with the vaccine, all right? And I don't mind sharing those personal details just to emphasize to people, I've got nothing to hide. You don't need to worry. I think what you should be worried about is if you still haven't had the vaccine yet and you've got those high risk factors, that you want to try and protect yourself, because the rest of your family is looking to make sure that you stay healthy. And if you can protect yourself through having the vaccine, then I'm sure the rest of your family will appreciate it.
Awesome, bro. Kayla has asked, can you explain the amount of vaccine deaths versus COVID deaths? Healthy people dropping and being disabled after the vaccine. That doesn't sound like it makes your immune system stronger. You don't have these side effects from COVID.
Yeah, look, I think that we need to be clear that there's more than one COVID vaccine out there. There's the Pfizer vaccine, there's the AstraZeneca vaccine, there's the Moderna vaccine, there's the Novovax vaccine. There's lots of different vaccines out there. And I think we have to be careful about talking about adverse reactions or side effects from vaccines and then painting the brush, that if someone gets clotting with AstraZeneca, that they're going to have clotting with Pfizer. It doesn't work like that, right? So we can't lump them all into the same bucket. We have to be quite specific about which vaccines give you which side effects. So apart from that myopericarditis case, that heart case for that lady that was in her early 50s, in New Zealand, I haven't heard of any other deaths from the COVID vaccine. Right. So that doesn't mean there haven't been any overseas related to other vaccines. Right.
So you're talking New Zealand, right? With the Pfizer.
Yeah. But one thing I want to say is that when the vaccine was first rolled out, and I think it was in the Scandinavian countries, it was rolled out on the elderly. And like we talked about last week, where some people had weakness of their face called facial, Bell's palsy or facial weakness. Some of these events happen randomly, right? And so when these deaths were reported in people over the age of 75, we know that can happen as a natural event in people over the age of 75. They can die. And what happened? They had a vaccine just before they died. And so there was this automatic association that having the vaccine can cause death, right? And that's when the research showed, hey, this is an association. And what it came out saying was that this was a natural event happening in someone over the age of 75. They can die. It wasn't because of the vaccine. And that's how some people then say, well, hey, look, the vaccine causes deaths. But there's not the evidence here to support that. All right. So I just want to make it clear is that you have to be very careful about statements and very, you can understand why people are worried when they sort of read stories like that. But it's only when you get the extra detail that you realize, oh, okay. So they were over 75, that group that were initially having the vaccine, and that's because they were the most vulnerable. So they wanted to protect them. That's how that happened. Yeah.
Yeah, that's why it's important that I've got a doctor on that's working on the front line, because there's no point. I don't know anywhere near what you know, so I didn't want to be one of those people jumping on and using their platform to talk about stuff that I just don't know about. If you wanna lose weight and be healthy and happy, then I can help you and I can share as much information about that, because that's my thing. That's what I do. And this is what you do. So thanks for that. We've got another question here from Jayzel. Have you got your vaccine? So you spoke about this last week.
Yeah. I've had both mine. In fact, I was talking with my colleagues yesterday. They said, hey, Richard, it's been 6 months since our doses. Do you think we should have a third one? I said, you'll have to wait to see what the government says. But at the moment, we can't. But yeah, so I'm fully vaccinated. And interestingly, I remember being on the front line last year when COVID first hit, and I was seeing patients with COVID, and I wasn't vaccinated back then because it wasn't here, right? But luckily, I had masks on, and the best protection I could. And fortunately, I never got it.
Geez, that must have been scary. And you were talking openly about it before. You've got asthma, you're overweight, you've got these underlying health issues. Geez, that must have been scary.
Yeah, well, it was scary for people. Like, you can imagine there were people queuing up, right? And I was at Airport Oaks on Kirkbride Road, and there were cars sort of queued up all along the road. The police were coming and checking on everybody to make sure that everyone was okay. And but there was an assault of a security guard, and people were very anxious about what's going on with COVID and wanting to get tested and who should get tested and so forth. And they decided that they needed to have someone like a doctor at these stations to make sure that the public were as fully informed as possible, so that if incidents broke out, that the things could be calmed down as quickly as possible with the right information, not people just sort of putting up barriers and saying, no, you can't. People were scared. And so we just need to have the best information available, don't we? And so it was a scary time for everyone last year.
Yeah, I'll be getting my vaccination tomorrow. It's funny that you speak about getting people wanting to get their third shots, because my mum, when she found out about our drive-through tomorrow and offering $5,000 cash prize for Monday and Tuesday, she was going, oh man, can I come get my third? So lots of people were messaging saying, can I come get my third? And always just I see other questions here about people coming, having to get boosters. Always go back to Mindset's team. If you have to go and get it once a year, is that really a big deal? And think about how the other stuff that you do. I'll be getting my second jab tomorrow in the arm, and I've made sure that I've let the team know that they have to have an extra strong needle to get through these guns. But We only got a few more questions, team. So we'll be able to. If the elderly has already had their 2 doses 6 months ago, are they supposed to have their booster? So again, we're waiting, right?
Yeah, that's right. And as I mentioned, it's likely to become a future recommendation once. I think the big push at this stage is to try and make sure that as many people have had at least 1 dose, and then with the 3-week gap now, then be fully vaccinated. So I think we're at about 89% in Auckland in terms of people having their first dose, but we've still got a little way to go to get everyone their second dose. But once we've got as many people fully vaccinated, then they'll be looking at the boosters.
Hey, bro, people keep talking about this Medsafe NZ. What is this? What is this page?
So Medsafe is where you can find out any information you want on any medicine that's available in New Zealand. So, as you know, in New Zealand we have a number of organisations or authorities that make sure that all the tests have been done and the studies have been done, and that show that something is safe to be listed as a medicine in New Zealand. And that information's collated by Medsafe. And so you can look up the Pfizer vaccine there and read up all about it, and how it works, how it's absorbed by the body. So on any medication you want, you can find it there on Medsafe.
So if people are doing their research on there, what are they finding on there? Why everyone's talking about, but this is what Medsafe says and this and that, with deaths and stuff like that.
Yeah. So as I mentioned to you before, we're not trying to hide anything, right? It's all on the table. So if you saw that there were some deaths in people, the Medsafe data doesn't present the actual individual cases, right? In terms of saying specifically that this was in a group of people over the age of 75 that died when they got the vaccine.
Yeah.
So you actually have to go through to the studies to find that next level of information, right? So you'll get like a summary of things, and drug companies are very risk averse. In other words, they want to list every possible thing that could potentially go wrong so they don't get sued, right?
Yeah.
If you didn't mention something and could cause this or that, then you haven't done your homework properly, and therefore we're going to sue you, right? So they'll list everything because they've got too much to lose, right? So, but it's when you go and look at the actual papers that relate to those things, that's when you find out the next level of detail.
And so that's what I'd advise people to do, is to go to that next level of detail, and don't rely on something you've just seen on Medsafe, or rely on people that are reporting on something they've seen.
Yeah.
Go and look at their actual case. Yeah.
So one of our questions we had last week was on someone that developed a complication called pancreatitis. The pancreas is an organ that lies behind the stomach. And so when I went and had a look at the next level of detail on pancreatitis, I found it was in a 96-year-old man. And he developed mild symptoms of pancreatitis and then fully recovered, right? So it's, again, you read about it in Medsafe, it might say pancreatitis, but it's only when you go and look at the next level of detail that you find out, okay, this is what it was. It was mild. It was a 96-year-old. It's one case. All right.
Yeah.
You think about how many millions of doses of vaccine have been given around the world.
Yeah.
One case in a 96-year-old, mild, right?
I think that's so important. I mean, there's literally millions and millions of doses that have gone out,
Yeah.
And I just see, look, I'm not judging anyone, but I see so many people, even people that I know, putting so much energy into anti-vaxxing stuff. They put so much energy. I wish they'd put that amount of energy into helping people and giving them food and stuff like that, just with the stuff that we see over here at BBM. But that's why I'm doing this, just to provide information for people. We've got one here. I'm an allergic to penicillin. Is it safe for me?
The answer is yes, because there's no penicillin in the vaccine.
Awesome. And I just figured out that I can do comments straight from here too, Doc. How good's this?
Awesome.
How do we apply for the vaccination certificate?
So you can get a letter from your GP, Right, so I just did some letters this afternoon for some people who are going to India tomorrow, and I was able to provide a copy of the laboratory result saying that their COVID swab was negative. I was able to provide a vaccination certificate to say these are the dates that they had the COVID vaccines, and this is the name of the vaccines, blah, blah, blah. So we can provide hard copies of those at the moment, right? But what the government's looking at doing, and certainly what the authorities are going to require, because in Europe they've seen a lot of fake letters that people are presenting to get across borders to say this is my COVID result, when in fact they've never had one, right? So they're looking at kind of special, like I mentioned last week, QR codes, for example, that will that can't be copied, and it will come up with your details, your results, right? So that's going to be, we're told that's going to be available from the end of November. But until then, it's the hard copy stuff that, we have to stamp with our stamp and everything else just to make it look legit.
Yeah. There's always going to be that element, of people fraudulating stuff. When you only got to look at what's happened with our borders here in Auckland.
Yeah.
With, unnamed workers, types of workers, getting about New Zealand. We got a question here. It's from Naomi.
Yeah, good question. We know that long COVID is defined as anyone that's got symptoms after 3 months of having the illness. So I've seen a lady that's been on television who's got long COVID, and she still has problems with her taste and smell. We don't know how long these symptoms can last for. We know that it can be a very long time. But I guess everyone's different in terms of how long they have symptoms for. Everyone's different in terms of what problems they have after their COVID vaccine, after the COVID infection. But, one of my colleagues went to the UK and came back from the UK. He got COVID while he was in the UK, and he's been fine after having COVID. So everyone, and he's not young. He's over 60. And he didn't have any ongoing problems yet. We've got this 27-year-old Samoan woman I was telling you about before. He's having problems, and the lady that's on TV, she's young too, having problems, right? So how long? Sorry, Naomi, I can't answer your question how long, but for everyone's different. So some people it can be a long time, more than 3 months.
Yeah. Again, another reason, get the vaccination, and you're less likely to get it, and if you do get it, you're less likely to get severe symptoms.
Yeah.
We got another question here from Haley. Medsafe list. I mean, you've answered this deaths from the vaccine every week. September 25th, 8 people died from it. Now, put this in perspective. How many millions have we done, right? So how do we read this information, Doc?
Yeah. So look, can I come back to that next week after I've had a chance to do some deep dive into that? Thanks, Haley, for raising that question. I think it's important that we do our homework in terms of looking at answering this question properly. So if we're coming back next week, bro, can I answer Haley's question next week if we can make a note of Haley's question?
Yep.
And let me do some homework, Haley, and we'll come back to you next week with the answers to your questions. And I'll find out about those 8 people that died, what exactly happened. Even if I have to go to Ashley Bloomfield, I'll get those answers.
That's going to build some suspense for next week. So thank you so much, Doc, because that's what it's about, getting the information. So you're going to dig deep. You're going to not just see what's on Medsafe. You're going to go and see exactly each case and find out. You're going to ring up Ashley Bloomfield and say what's going on, and get some information, get some answers for us. And that's what it's about. That's what it's about. Don't just read that and take it. That's it. You've got to dig a little bit deeper. So that's cool that you're going to do that for us, and that'll be our first question.
Yeah. And I'll see if I can age profile that as well, right? Because we want to know the ages of those people. We want to know, were any young, were any old, were any middle age, what have you.
Yeah.
Do they have any other comorbidities? Like, did they have heart problems? Did they have lung problems? What have you? I'll try and do the deep dive for you, the answer to that question, Haley, because I think lots of other people want to know those answers too.
Yeah.
They want that
Haley,
assurance.
And Haley, please don't feel I'm happy you asked that question, and that's why, again, we're not hiding anything. We're answering all these questions. We're going to have to come back for I think for a few weeks, bro. This will be the first question that we'll leave it here, I think, and this will be the first question that we answer next week. Haley, please don't be embarrassed, or don't. These questions you're asking will be on the lips of so many other people.
Yeah.
Thank you so much. And we'll just see where we're going here. Yeah. We'll leave it there, Doc. Actually, no, we'll answer one more question. I got one more because there were so many from last week that I just want to get through one more. Okay, we got here. I think we got through. Wait, not here. We got this one here. Why isn't that? So first of all, we're not the NZ government, and we haven't been asked by the NZ government to come here and do these interviews. So I'll put that out there first. We haven't been asked by anyone to do this. We're just doing on our own to get information out there. But why isn't the NZ government putting information about treating COVID if you get it? Are there any medications that can help?
So there are medicines that are given to people who are obviously in hospital, right? Medicines that help people breathe, medicines that help people to try and fight the infection, because we're talking about life and death situations. So again, some of those medicines there's no evidence base for. And so they have to be on oxygen, on a ventilator before they get some of those medicines, right? If they're not requiring oxygen, they don't get the medicines. And that's because we're trying to save lives there. So where the evidence isn't there to sort of say 100% this works, then it's people's last chances to try and keep them alive, right? So I just want to say that about medicines for people who are in hospital, who are already in intensive care. Yep. Now, there are other medicines that you may have heard about, something called ivermectin, right? Ivermectin is a medicine that's given for tropical diseases like filariasis, which is that kind of worm that blocks up people's lymphatic systems. And you've probably seen pictures of a guy that's got swollen legs or swollen scrotum or something like that, because the lymph fluid can't drain, right? And I think the picture was the guy had his scrotum sitting in a wheelbarrow because everything was so swollen, right? So ivermectin is one of these medicines that's an anti-parasite kind of medicine. Now, there have been some studies done in the laboratory showing that ivermectin can have some effect on the virus. Now, unfortunately, working in a test tube doesn't always translate to working in a human, right? And so there aren't any clinical trials on the use of ivermectin, for example, because the antiviral effect that they see in the lab, in the test tube studies, if you looked at what dose that equates to, it's a dose that's 100 times more than the recommended safe dose of ivermectin, right? So there's a lower dose that's used for treating things like scabies and things like that, but it would require 100 times more than the recommended dose to try and be effective against COVID. And so hence, at this stage, there are no clinical trials, because that if you imagine taking 100 times more of a medicine, you can expect some side effects from the medication, right? So that's why there's no studies done at this stage.
Awesome, bro. And just on last words from me, I believe that the people that are absolutely against it, and then you've got the anti-vaxxers, I don't think we're ever going to convince them. And I'm not going to judge them either. But what I'm trying to do is, and what we're trying to do is give information for the people like Haley that are on the fence and just a little scared. And that's what these are for. So thank you so much, Doc. Last words from you, bro.
Look, it's a long haul, isn't it? It feels like we've been saying get vaccinated for a long time now, and we're still not there yet. And people have a right to choose, and I think that's what we're saying today, is that we're here encouraging people, trying to give people as much information as we can, truthful information. We're not trying to hide anything, not trying to sanitize it. We're trying to give people the best information possible, right? And if we don't have the answers, happy to go and find the answers. and
Yeah.
bring those back here to the show. So yeah, thanks for all your questions tonight, everyone. Keep them coming in, and yeah, we look forward to next week.
Yep, and that first question will be Haley's next week.
Yep.
And Doc, don't forget, send out the poster to all of your patients that haven't been vaccinated yet, with that opportunity to perhaps win $5,000 tomorrow and Tuesday. We're putting up, me and the owner of Pack and Save, Lockie, we're putting up our own cash there, putting up our own money to help to try and help those that are sitting on the fence. So
Awesome.
thank you so much, bro. Thank you, team, for joining in. And I'm going to go have dinner. I'm very tired. I'm going to have dinner and go home and wake up. I'm going to do it all again. Thanks, team. No excuses.
Stay safe, everyone.